Then you can have dinner the night before. Just
dinner Right.
So then
High five.
And they get the good night sleep.
Oh, okay.
So they get the good night sleep. Otherwise, they sometimes that's one of them. So usually it's afternoon school now. The weather is fine. Yeah. So then at least the one
Can I take some breakfast? They can, right? But not. No, at night they take dinner. They can have So you have to check.
By then, they come out. They also end up
So when they come back,
No, that's good. No, Color Park has some.
in the morning, 7
Yeah, just rain. Yeah,
we always like 7 a.m. But now they don't eat breakfast.
okay.
When they come out, it's really like, please.
No, I mean, I just wanted to because all this money, right?
We are at the mercy of us.
Oh, so it's not your hand.
We are at the mercy. And stuff. So,
One of the things is,
it's very difficult for us to explain to the client because clients referrals tell them it's like that. Because she wanted.
Yeah, good. Hello.
But the friends really.
so you give her
Clients referrals tell them it's like that. Because she wanted.
Yeah, good. Hello.
But the friends
wake up and walk her and so then after or I rather give them my food.
No, we are always in the mercy of ourselves. There's some meaning with her,
Yeah, or maybe let us know what the that preference.
Okay, our client's preference is normally like after seeing the doctor at say 11 o'clock, so probably check in about 1 o'clock. Then the dinner will be the light dinner. Then power is from 8:30 p.m. Right? And then after that, the next morning about 9 a.m.
Okay, so this is the preferred timing.
All our clients prefer timing.
No, I don't know. I know all these things.
Oh, and okay, I mean, see, most of the clients, they don't pay for consultation.
Yes,
Some,
yeah, I thought it.
No, it was not. So one of our clients, when during consultation, that was about a week ago. Because we actually tell her.
No, actually,
then there was a lot of forms, to me, I said, wow, when I talk to the client, why was this different? So we are like, I said, no, I didn't.
But they did let our staff know.
No, your staff really push out. That's what they told me.
But the other time, the first time we paid for the
Of course, I was never charged.
What happened was,
in the hospital, it was
No, I think I'm not sure what is your
Preference. Sorry.
Yeah, so, I mean, if
And
you,
now we are told that Jurek is the one handling wellness and medical.
yeah. So if
Not
you
pain
have,
anymore.
yeah, I mean, in terms of that, that's why you feel like, students are really good at it. Then I say one thing and you are there, like, I really don't know. It's like,
Right.
So if you have a set of preference, let us know so we can do it. Because if we don't know, we just do, you know.
Oh, okay, understand.
So let us know what is what.
So should I have a meeting with Jurek and tell
Yeah,
her
we can,
our preference?
yeah. If you want, we can do that. So at least someone knows if the note because it was like, all the rest.
Yeah, that's the thing.
Should be actually I would probably
Have a
the SOP.
SOP,
Yeah,
so yes, SOP.
Yeah, so if we can, I don't think it sound like the upbeat, but but if you can SOP, let us know what you want by things like that.
Sure.
Then it's easier for them to follow. But if there's no, then it's like, why don't you try this? Why don't you try that? And all that stuff like that. Yeah. Because even if they ask me, I really no idea what exactly.
So,
We can pass us, then we can actually put it in our SOP. So at least we know where to refer to. Because before that, we're like, something here, something there. Yeah, so that's the thing. Yeah.
let me have a meeting with Jurek.
Everything online.
Okay.
It's always your price preference.
So this is what I was told that you all chose the timing.
No.
Yeah, so really, because
Because I was thinking that
Mercy of
the clients will be like,
Actually, Joey is doing very well after I told her she's accommodating.
Okay.
Because I'm very sorry, this was, because hers is urgent case, that's why she squeezed into your busy schedule. That's why it turned out to be
Usually for your clients, right, how long in advance will you
Oh, that's a good question. I said 2 weeks. 2 weeks is really okay for you.
2 weeks is okay, so that because you want me run tickets, and then I run
3.
4 yeah.
but only 1 week is emergency.
Yeah, so if like that, like I mean, if you want a timing and all that, sometimes it's easier.
But sometimes, like the other days, we have 1 week, stomach pain, then that's
Excruciating pain.
No, they can see lah, but
that one sure we got to do.
Yeah.
Because don't know what happened.
yeah, but the only thing is,
But these are very rare one. We normally have pre-planned like 2-3 weeks like this.
yeah.
These are planned.
No, I mean, if you do have any like this specific day, want this start timing, all this process, right? Until that's why that day when you asked me about, can have breakfast and things like that. That's why I was like, okay, what do you get?
You see, if we do the bowel prep the night before and don't get the colonoscopy the next day at 3 p.m., the patient is suffering.
Yeah.
Because I went to colonoscopy
So
before.
if you are doing it the night before and still have no breakfast, like your children is not.
Exactly.
Yeah. So that these are the issues.
Yeah.
We usually refer them at night all the way. Then tomorrow very quick. Because never eat. And also easy if let's say you need to give her let's say after that you do already, you say, wow, I need to go for a scan.
Yeah.
So
That's right. So it's always.
I think as a
yeah.
Yeah, let me meet up with
yeah.
Among Novena. Yeah.
So at least we understanding is like you all don't know them like we think you want this or we think I don't know.
I'm sorry about this, but
Okay. So
Yeah, it's a lot.
yeah, so sometimes we come for the schedule and all that. I mean, if you people are coming, sometimes last minute then they have to look for swap like what kind of So at least it's really good on that. I mean, let us know what your preferences are. Because I don't know. I mean, so all I know was okay like that. Right? Then after that they said, oh, cannot move or something. This one very thick and all that stuff like that. Stuff like that. So then I thought it was thick, but not all that stuff like that.
And I also spoke to Doreen today because I also requested her whether is there any slot for Jocelyn, which is my client, on in the morning, 6 morning.
But this is in Farrer, right?
In Farrer Park, Farrer Park.
Yeah, so that's 26. So that's why usually by next week we spend it up.
Let's see, it's true. But oh, okay.
That's what happens.
So that could be good.
So what happens is like in Farrer, right? So it's like what about the road that's so we put the trucks there. So there's also
Constraint there.
yes, that's right. So when we shuffle people around, it's not that usually we have like code so whether they can stop or that.
Okay, good evening, everybody. 大家晚上好，晚上好。OK， 我们差不多要开始了。OK， 大概2分钟，2 minutes we will start. OK， so please get yourself ready, not by standing or sitting over there, but coming forward. OK， I know today is your special day. So special day must see in front. Okay, fill up the front rows first. 坐前面啦。我们新加坡人真的很奇怪。Singaporeans are very funny. Singaporeans and Malaysian a bit funny because usually the front row will be empty one. 公司班长7页，你们给谁坐？不然坐前面。我是给C1啦。对，这个是我每次讲的。OK， 他跟我讲what she told me usually OK during our presentation OK the speaker and in this case is the doctor today and later will be some other people including me OK we will always ask question from where 我们每次问问题会从哪里问？我们每次会从最后一排问，只有最后一排才需要回答问题。OK， only those people sitting at the back. I can guarantee you, front row, nobody needs to answer any question. OK， I can guarantee front row nobody needs to answer any question. But back row confirm need to answer question. OK， 还是没有人要坐前面。OK， 你们坐前面吧。OK， so 差不多要开始了。So we are going to start quite soon. OK， 还要等谁的吗？有谁还没有来？有谁在路上 ？Anyone still on the way? If you are on your way, please raise your hand. It's all here already. Okay. So actually today, okay, today's talk will be in English. Okay. So you all know what you all are here for. 今天你们懂来这里是干嘛的吗？来这里看什么 ？Wisdom. So cannot answer. First one cannot answer. Sorry. So I shall ask the last row. Okay, ask the last row. 来，今天你为什么来这里？你 Listen to the talk. So what talk is this? About colon. Okay, what do you know about colon? Okay, sir, what do you know about colon?
Not very sure.
Not very sure. Okay. Second last room, I will also ask. Hello. Hello. Okay, what do you know about colon? Colon 是什么？我们的肠啊，所以我们的肠是什么东西？就是很长就对了啦，对吧？对，就是很长就对了。OK。Okay, so without further ado, let me introduce Dr. Eileen Xia. Okay, 让我们介绍 Dr. Eileen Xia. Okay, Dr. Eileen Xia graduated from the medical school at National University of Singapore in 1995, our local university. And she obtained her fellowship diploma from the Royal College of Surgeons in Edinburgh in 2001. Okay, 蛮了不起的啦。Okay, 给她一个掌声来。Okay, I still need another 5 more minutes, okay? Another 5 more minutes. Okay, so she completed advanced surgical training in NUH and became the fellow of the Academy of Medicine, the accredited specialist in general surgery in 2005. Okay, another round of applause. Okay, only halfway through, okay? So Dr. Xia was awarded the Human Manpower Development Program Scholarship in 2003. Again, scholarship, and was admitted to a match residency program that was accredited by the US Accreditation Council for Graduate Medical Education. Okay? Okay, and she completed her colon and rectal surgery fellowship at the University of Minnesota. Okay, in 2004, under the mentorship of Dr. Stanley Goldberg and many other doctors, and became the first American trained female colorectal surgeon in Singapore. Okay, I know you're joking. Okay, so without further ado, okay, let's welcome Dr. Eileen Xia.
Very basic, man. Okay, this is going to be a very easy-going talk. So if you do have any questions, you can ask me, or I will ask you, or you ask her, right? I can ask you. Okay. Okay. So today's talk is about your colon and you, right? Okay, so do you know where the colon is? Okay, so this is your colon. You can see it's located inside your belly at the periphery. It's the last part of your intestine, so your food will travel to your mouth and then inside your esophagus, your stomach, travel to the long small intestines, and then after that come out through the go pass through the colon. The colon is about 1.5 meters, and the purpose of the colon is actually to suck out water and dry out all your undigested food and all that, so that you can, then it becomes stool, right? So then after that, and it also stores the stool, so that when it's time to go to the toilet, you just pass it on. Okay, so that's the function of the colon. So what does that have to do with you? Just a few facts. In Singapore, the colorectal cancer is the most common cancer in Singapore. So for men, it's the #1 cancer. For women, it's the #2 cancer. But combined, it's the most common cancer. For women, it's #2 after breast. Okay. So I think over the past 5 years, our statistics, in Singapore, we get about 1,500 new cases every year of colorectal cancer. So all of us, right, if you got no family history, our risk of getting colon cancer is about 5%, 1 in 20. So if you got your friends and all that, 20 of you, right, usually one will get colon cancer. Okay.
So this is just to show you the statistics. You can see. So for men, right, it's colorectal. It accounts for 17%. For women, it's colorectal again. It accounts for 13%. For breast, because all we have 2 of them, right? So that's why the numbers are higher. Okay, so this is taken from the Singapore Cancer Society. You can see again the top cancer, colorectal for women is after breast. And if we talk about causes of death, right, and just purely from cancer type of causes, right, colorectal cancer does account for, it's the second most common for men, and then for women, the third most common cause of death. If you're just talking about cancer. Okay, so our lifetime, our risk, right, it increases. That's why our screening programs, right, start at around 50. Our risk of colorectal cancers increase after 50, and this is just to show you. Okay, so this chart, right, is to show you that, okay, this is the age group 0 to 90, 29, and all that. So our risk of colorectal cancer is like, okay, quite low, right, until we hit our 40s and all that. And then once we hit 50s, we have zoom, okay, the risk goes up. The risk of colorectal cancer goes up. So that's why our risk of colorectal cancer goes up after 50. Okay, so how does colorectal cancer, the colon cancer, how does it grow? Okay, so what happens is, if you look at this, right, this is the wall of the colon. This part is the inner side, and this is the outer part of the wall of the colon. So usually what happens is there's a single layer of cells, so they're like soldiers, right? They march up, and then after that, after a certain age, they're supposed to drop off and die. But sometimes some of these cells, they forget to drop off and die, then they still stay there, right? So after that, you know, it's like a whole bunch, right? They start bunching up together. And that's how a polyp comes about. It's actually quite a few cells stacked up together. And then more and more stacked up inside the polyp, okay? So, and one of these days, one of the cells, right, they turn bad. By turning bad means that they change their shape and all that, and then they become unpredictable. They don't stay in the same place and they run around and all that. Start growing extra fast and all that. So this is how a polyp grows, right? And then when the bad cell grows beyond the layer, like the wall, that's when it becomes a cancer. Okay, so this part, right, this whole process from here to here, right, takes about 5 to 10 years. Okay, so just to get an idea of 5 to 10 years, all these numbers, they play a part because that's why we come up with certain figures for how often you should do screening and all that stuff like that. Okay. So again, just to show you the different stages of colon cancer. So you can see, right, stage 0 is just at the surface. Stage 1, it's grown but didn't penetrate through the wall, the entire wall. Stage 2, goes through the entire wall, but the lymph nodes, the cells hasn't, run over to the lymph nodes yet. Stage 3 is when the lymph nodes are involved. So that means some of the cells have escaped and then migrated out, right? And so this is stage 3, and then stage 4 is when the cells have gone to other organs. Okay, so these are the usual stages that we talk about when we talk about colon cancer. So, can we survive colon cancer? Is it a death sentence? No, it's not. If you actually pick it up early, like let's say, okay, so if you pick it up early, the survival rate is quite high, about 95%, 95%, 5 years survival. That means like in a whole cohort, 100% with stage 1s are alive after 5 years. So what this chart tells you is, the earlier the stage, the better the survival. Okay, if you pick it up later, then the survival chance and the odds all go down. Okay, again from Cancer Society. So we always, there's a lot of education on this. Why? Because colorectal cancer is so common. So at least, the more you know about it, then the more you can do. So things like, they always talk about the red flag signs, the signs and symptoms. If you do have any blood in the stools, So not all blood is hemorrhage, right? We always hear about the case of the uncle who, or after all these years, he got blood in the stool, right? Then he said, oh, I think it's eaten hemorrhoids and all that, right? And then after maybe about 1 year, then it turns out it's actually a rectal cancer. So not all blood. So it's good to get blood if the stool's checked out. Any change in bowel habits, not the ones that you get from food poisoning, but sometimes like, okay, if you are the one every day, 8 o'clock pass motion, 8 o'clock on the dot, right? Then suddenly one day you pass motion 3, 4, 5 times and everything all changes, right? And this stays on for more than 3 weeks, that's a change in bowel habit. Okay? If you have any abdominal pain or you feel some lump, right? And then there's some funny lump in your tummy. So these are things it's good to get checked out. And of course, unexplained weight loss. You always suddenly you've been losing lots of weight, your clothes are very tight, everybody says, wow, what have you been doing? Why you lost so much weight? These are signs, red flag signs for you to actually go and check out with the doctor. And even anemia as well, where suddenly okay, and then faint, and then so a lot of times some of our patients, right, with right-sided colon cancer, they just faint. And you have to find that their blood counts are very low. And actually, lo and behold, they check out another, they will check the stomach and the colon, and then they do have a right-sided cancer. Okay? And then over here, what are risk factors? Again, like just now, I showed you the risk of colon cancer goes up right after 50. So 50 years and above, any family history. If there's any family history of colon cancer, especially if it's a first degree relative, so mother, father, brother, sister, okay? And that will also remember, if there's no family history, our lifetime risk of getting colon cancer is about 5%, right? But if you've got a first degree relative, your mother, father, brother or sister with colon cancer, then your risk gets double, it goes up to about 9 to 10%. Okay? So, and if and then inflammatory bowel disease, this one tends to happen less so in Chinese. This when you produce something like lupus, but more for the intestines. Okay, that's when your body produces extra antibodies and attacks your colon. Okay, so this one tends to be seen more in the Caucasian population or the North Indian population. So not so much in the Chinese. And then of course things like high, your diet is has got high animal fat, low fiber diet. So these are risk factors if you're inactive and a little bit heavy. So of course smoking, right? Smoking is always linked with a lot of cancers and alcohol as well. Okay, this is just something I'll share with you. When I was in NUH, we actually looked at our patients over 1 year, just to see how much money they spent after they got diagnosed with colon cancer. Actually, one of my patients told me, he said, wow, this is equivalent to a Toyota Corolla. And that time, the Toyota Corolla cost, not like now, it's like 75,000. Yeah. So anyway, so this was a paper. And so what we did was we looked at patients from 2008, so quite a while ago, and 2009, and then we calculated how much we spent in 1 year. So including their surgery, all their blood tests, their scopes, and even their chemotherapy and radiotherapy.
What is it supposed to be?
It's supposed to be a pie chart.
Pie chart.
Okay, anyway, so it's not coming out, but what we found was most of our patients in NUH, right, more than 50% of them were stage 3 and stage 4. They were the later stages. They were not, okay, then I cannot ask you questions on these slides. I think so anyway, most of our patients, this 2008 and 9, and in NUH, mainly, so more than 50% were stage 3 and stage 4, less in stage 2 and stage 1. And actually that corresponds with our national data as well. So it's also the same across the board. Most of our patients were waiting too late before they sought help for their cancers. Okay? So remember, the later the stage, the more dismal the survival. Okay. So I think a lot of us colorectal surgeons, what we are trying to do is we're trying to push it, try to get more people aware of colorectal cancer so that we are able to get people seek treatment earlier. Okay. Anyway, so what this tells us is it costs more to have rectal cancer because you need to have radiotherapy versus colon cancer. The amount that they were spending, so this was in 2008, so prices have gone up also. We were actually, okay, let me remember. It was for colon cancer, it was around average of about 31,000. Okay, and then for rectal cancer was extra 5,000, so it's 36,000. Okay, so that's how much an average person spends that in NUH at that time. So again, I don't have this slide, but anyway, this was a slide that was supposed to show how much each this is separated by stage. So you can see, right, as the stage goes up, so the patient with stage 4 spends more money treating their cancer compared to someone in stage 1. Stage 1 only has to pay for surgery and a bit here and there. Stage 2, 3, 4, you need to spend on extra. So as your stage goes up, the amount of money they spend also goes up. Okay, so this was also the same for rectal cancer. And so basically, what I was just sharing is actually it's not cheap, right? Who was it that said that in Singapore? It's better to die than to save because so much now. Okay, so what can we do about it? How do we prevent colon cancer? Okay, so this again from Singapore Cancer Society. If you look at this, right, essentially two main things: go for screening. So if whatever cancer it is, main thing, if there's screening programs, go for screening. Okay, that's one way of preventing. You can cut down on the incidence, the possibility of cancer if you remove all those that can potentially. It's like weeding, right? Your garden, if you cut out all the small little weeds, right, you can keep your garden nice, right, instead of it overgrowing with weeds. And of course, I'll share with you some things about healthy lifestyle. Okay, let's talk about screening. So what does screening do? It decreases the risk of colon cancer, right? So remember I showed you that for it to grow into cancer, it starts from nothing, then a polyp and all that stuff like that, and then before it goes, and this takes about 5 to 10 years. If you remove the polyps, right, then you remove the risk of getting cancer. So that's why screening colonoscopy reduces the risk of colon cancer. Oops. So that's what it means. It reduces the incidence, the number of colon cancers. It decreases mortality from colon cancer. Why? Because of this, you are able to pick out. With a screening program, you are able to pick out cancer at an earlier stage and have treatment at an earlier stage. So if you remember, 50% of colon cancers, right? The earlier stages, they don't have any symptoms. So if you do something, it's really pick it up, you are able to treat it before something happens, like you have blood or you get blocked in the okay? And so that's what I mean by earlier stage and pre-malignant. And so because of that, you are able to actually treat, right? So polyps, right? Once you remove them, and that's not surgery, you are doing endoscopy, right? Colonoscopy, then you remove the polyps, and then after you remove your risk of colon cancer. Okay, so there are several types of screening modalities, screening tests. Most commonly, there's the colonoscopy, there's the fecal occult blood test, or the CT colonography, which is also known as the virtual colonoscopy, and then the barium enema. Okay, this came out, I know it's quite a busy slide. This came out from MOH. So MOH has guidelines which they actually send out to doctors. So just going to share with you. They have actually divided people into different risk groups. If you got no issues, right, asymptomatic, no bleeding, no change in oil habit, anything like that, no family history of colon cancer in the family, you're of average risk. If you have some relative with colorectal cancer or who are 60 years or younger, or 2 or more first-degree relatives, or if young colorectal cancer in the family, if you previously had colon polyps, any history of colon cancer, or any ovarian or endometrial cancer, you are at increased risk. Okay, and of course the very high risk ones are all these syndromes, right, genetic ones, where they got lots of, this one got more than 100 polyps in the colon. And then this is another syndrome. So the risk, average risk, right? You can use this screening tool, either the FOBT, the fecal occult blood, the stool test. You can use colonoscopy or you can use virtual colonoscopy. Okay. But for the others, if you look at them, right, it's all colonoscopy if you've got increased risk or high risk. Okay, so I just go through with the different modalities. So for colonoscopy is when they actually put a scope up through the anus and then they look at the inner lining of the colon. So if you look, this is the tip of the scope. It's about this thick, or maybe my thumb, okay? And at the tip of it, you can see, right, this is the light, and then this is the camera over here. And we actually have got a channel where we can put in things, either to take biopsy or to burn or stuff like that. Okay, so this is our working channel. So and because there's a camera that is connected, and then it's a real-time examination, you can actually see the inner lining of the colon. So this is put into the anus, okay, and then it goes and has a look at the whole colon. So we're actually looking at your whole colon, just like you looking at your skin or your face, right? In the mirror, right? You're looking everywhere, right? Same thing, you're looking inside the colon. Okay? And again, this is for all types of risks, average, increase, and high. Every 10 years, if you're of average risk. And usually we do it under sedation. So you can choose either you want light sedation or heavier sedation where you don't know anything, all available. Okay, this scope you can last for 15 minutes, half an hour. And you can see, right, you can put things inside and you can do things, and like, let's say there's a polyp, you can remove the polyps. Okay, this is same side. So what this one does is it looks at the inner lining. Remember the colon cancer, right? The polyps start growing from the inner lining. So by looking at the inner lining, you are able to treat this first. Okay, so then you see, what can you find, right? You can find this is normal colon lining, although there's a tumor in the distance. This is what cancer looks like. This is a polyp, you can see, right, there's a spot down there. This is another cancer. So this is what we see. So real time we see this, right? How do we go, right? When we're doing the scope, we find something. If we find this polyp, we will lasso it out, we will remove it. If we find this one, we'll take some biopsy and send it off to test to see whether and confirm that it's cancer. Okay, this is just to let you know how we remove a polyp. Right, so you can see, right, it looks like stalk, right? It looks like broccoli. Okay, so you see, right, got a stalk there, right? So what we do is we actually have a metal wire like a lasso, right? We put it over here. Then we tighten over the neck down here. And then after that, we pass a current to the wire. And it goes, so after it goes beep, and then after that it cuts, and then after that that's the stalk that's left. Okay, and you can see, right, that's the polyp. So we'll take this polyp and then take it off and send it off for testing. So you see, by removing this polyp, you have removed the potential of this turning back and going into a cancer. So that's how you increase the risk of colon cancer. Okay. I know bowel prep. So before you go for a colonoscopy, right, we always give you some medicine to give you fast motion, so that you clear 3-4 days worth of stool. And so that's why it's quite important to actually, I know sometimes it tastes yucky and all that stuff, but it's good to actually go through it and drink such that you purge out all your stool. Why? Because the cleaner it is, you get a better examination, you can pick up all these yours. If it's inside so dirty like that, right, with carrot bits, and then I don't know what this is, right? You can't see, right? So you can be hiding a cancer here, you can be hiding a polyp, or is it nothing? So we're not sure. So if your bowel is not clean, right, then it's a bit bokake, like you didn't have a good examination. So even if you had a scope done right, not clean, right, then you're not sure, oh, did they miss anything? Because once it's dirty, the chances of missing things is higher. Okay, so what's the risk? Okay, quite small. Risk of bleeding is 0.1 to 2%, especially if you take polyp out. Risk of perforation, which means it's injuring the colon, 0.1 to 0.3%. Again, very, very small. Okay, so I always tell my patients, the risk of getting knocked down by a car in Singapore, not in Singapore, is actually smaller than, it's actually higher than this risk. Okay, and sometimes because there's holes and all that, there is a risk of missing some like polyps or even 5% for cancers, especially if it's a small one. And things like if you are taking things to clean out your blood, especially if you've got stroke before or your heart and all that, right? Sometimes we actually need to discuss, let the doctor know about it so that we can see whether we can stop it. Because if you've got these type of medicine, then the risk of bleeding goes up a little bit more. So we need to discuss all this. Okay, so this is the other modality. This is a virtual colonoscopy. So it's actually a CT scan. We do a CT scan. So this will show you the CT scan machine. We do CT scan lying down and facing up. So it's 2 runs of a CT scan. Okay, and then this is only for average risk. So if there's anyone with high risk or increased risk, right, then they should be doing a colonoscopy rather than this. And this should be every 5 years. Okay. For example, anybody cannot do colonoscopy if they got difficult colon. Their colon is a little bit very lumpy and all that. It's very hard to do a scope. This is also a possibility. You can use this. And so you can see what happens is when you do the scan, it takes many images, then the computer will reprocess it and get a 3D image of your colon. So see, that's what you get, right? So over here, after they reconstructed, you can see there's a polyp over here. So again, you also need to, so some patients think that they can avoid the bowel prep, right? By going for a virtual colonoscopy. Not true. We also need to give you bowel prep. There's 2 runs of the CT scan and then again recon. And the thing about CT scans is they will also look at your liver, the solid organ, liver, pancreas, and all that. Okay, it's actually a CT scan. So you can see this is what it looks like. They will reconstruct it again. The radiologist, right, will look out for polyps and highlight them. And if any of these polyps are found, then we will also need to go back to a colonoscopy to check it out and see whether is it a real polyp or is it just some stool stuck on it. Okay. So it's good if the polyp is 1 centimeter or bigger. But if for polyps that's 5 millimeters or smaller, it's not so good. And yes, there is a risk of perforation because we do actually pump in air as well inside. But it's very small, 0.04 to 0.08. Okay, so just to show you, CT colonography is about 50 chest X-rays. So this is just to tell you all the different X-rays, right, and how much radiation goes to it. Okay, so it's equivalent to about 50 chest X-rays. Okay, so this is another way of testing. This is the stool test. I think every time a colorectal cancer awareness month in March, the Singapore Cancer Society will hand out, or you can get these kits, right? They have road shows where they do this, people will talk blood tests. And you can see, so what happens is, it is again only for average risk. It's just what happens is local blood, right? So that means if you got hidden blood inside your stool, which you cannot see with the naked eye, this can actually tell you that you got that. And once you find that there's hidden blood, right, then the next step, right, if it's positive, right, the next step is actually to do a colonoscopy to see whether there's anything. Okay, so The thing about this is not every 5 years like a CT colonoscopy. Or 10 years if it's a colonoscopy. It's annually every year, and every time you do it, you need to have 2 samples, not the same stool, but 2 separate days, right? For it to be a valid screening tool. Okay, and so of course it's quite cheap. So this is used in UK because their health care is free. And then again, you can get this from Cancer Society. It's free for all those over 50. Okay, if you can see blood inside your stool already inside your toilet bowl, right? Don't bother doing it because it's going to be positive. This is looking for hidden blood. If you already got obvious blood, definitely it's going to be positive. Okay. So how do we do this, right? This is okay. Over here is something like a toothpick, right? So what you're supposed to do is stick this toothpick inside your stool. I'm not asking you to pour onto the carpet, right? But actually what you do is you sit a little bit, you know your toilet bowl, right? The dry part of it, you line it with some toilet paper and you sit a little bit forward and you put into that, and after that you put the toothpick thing, right, the one, and you stick it at 6 different places. And then after that you cap it and you shake. Okay, and then in Cancer Society, they will give you a special envelope for you to send back to them, and they'll do the test for you. Okay, so that's right. Yeah. So after that, you put that, they put it on a special envelope, and then you send it to the Cancer Society. Okay, and then what happens is they'll do this test to see whether there's blood inside or not. So if it's positive, if there's hidden blood, you should do a colonoscopy. Okay, this one. I think this is getting barium animal or something which we used to do a lot before colonoscopy. But nowadays with the new modalities, right, these are getting more and more rare. Okay, so what happens is they will pump in barium, this white paste, right, to coat the colon. They will pump in air, and then after that they'll shift up and down so that the barium and the air will shift inside your colon. So you can see that between that, and then after that they'll take an X-ray of it. Okay. So this is what the barium animal looks like, and then I think this is normal. And then you look for polyps or cancers and all that. Okay. Again, if there's anything, still need to do a colonoscopy. Okay, so a lot of patients come in with this. A lot of health screening packages have a CA, okay, CA 125, CA, and all that stuff like that. A lot of patients come in with like, oh, my CA is a little bit up and all that. So once it's up, we always have to offer a scope. But I don't think this is a very good screening tool because there are patients with normal CA, with colon cancer, still with normal CA. So if your CA is normal, doesn't mean you don't have colon cancer. Okay, and we have also scoped so many people who have got CA, raised CA, but no cancer. So it's not a very good screening, but it's always used in a lot of health packages. This is just to give you all awareness. Okay, and this is one of the things that may be coming up. They look at stool DNA for cancer DNA, but right now it's very expensive and it's not standardized, so it's not a very good screening tool. Okay, healthy lifestyle. Again, alcohol, smoking. These two has been proven and all that. A lot of studies have been done to show that they've been associated with many cancers. Okay? Not just lung alone, no, many colorectal, esophagus, cervical, and all that. Okay, even being a bit heavy also is not good as well. So that's why we want to stay healthy and exercise. Okay, red meats, processed meats, and all that are not good. So you try to reduce them. And of course, your proteins, right? You want to do more chicken or fish rather than these red meats and processed meats. And carbohydrates. You don't want to have all the refined sugars and all that. You want more of these unrefined grains. Okay, so these are studies, right, which they show, they try to classify, because a lot of people say, oh, take more of this, take less of this, take do this, do that, and all that, right? So they actually looked into it, and this is data to tell you which one is strong. So dietary Fiber is strong, so it's convincing. Physical activity is strong, so it's convincing. See, the rest are probable or limited, so things like milk and cheese and all that. So if you really want to have bang for your buck, right? So you probably do this fiber. So think of fiber, physical activities, and then we go down this road, which is convincing for improving. So sorry, for increasing the risk of cancer. So red meats are quite strong, the association. Alcohol definitely, and yeah, and what's that? Yeah, okay, and having being heavy, being a fat, right? That increases your risk of having colon cancer. Okay, so a lot of these are actually taken from the Singapore Cancer Society. You see how many cancers smoking can give rise to, but colon is here. See, so colon smoking does increase risk of colon cancer amongst all these. So we should stop smoking, and of course smoking is not cheap either, right? And then drink less alcohol. If you look at all this, right, also can develop cancers of oral cavity, throat, larynx, esophagus, liver, breast, colon, see? Colon and all. So this is a recommendation, not more than 2 standard drinks. So 1 can of beer is equivalent to 1 standard drink. 1 can of beer, 1 glass of wine, 1 shot of like whiskey or all that. And of course, exercise. So this is a recommendation, at least 15 minutes of moderate activity every week. And I think this is from Japanese, right? Japanese or Korean, they always, you know, when the mothers always pack the food for the children, right? They always make it colorful, something from every color. So same thing, you want to have vegetables and fruits from every color. We have a well-balanced meal. And of course, this one is about obesity, so try to have a less sedentary lifestyle and be active. So, take-home message, in Singapore, colorectal cancer is very common, and anyone can get it. So your risk factors, once you're more than 50, if you have family history, so you can do something about it, right? Not that you just sit there and wait, right? You can do something about it. Screening, went through, and having a healthy lifestyle. Give up the smoking, give up the alcohol, okay? And so the aim is you want to have earlier detection, and you want to have removal of polyps. Removal of polyps is not surgery, it's just a colonoscopy, you remove it, you don't feel it at all, you're asleep and all that. It's not even a surgery at all. In fact, you can be awake and have the polyps removed and you don't feel it, okay? And then, of course, having it treated earlier means that it's cheaper. Okay, so in terms of healthy lifestyle, stay lean, exercise, eat smart. Okay, that's okay. Do you have any questions? We burn. So remember, there's a stock, right? So we have it's a wire. There's a lasso kind of thing. So what happens is you put it over the polyp at the next section. Then after that, you can tighten it like that, right? So as we tighten it, we apply an electrical current to it, and then it burns. So that's why at the end you see that white thing. That means that now burn already. So that's how you stop the bleeding. Yes, that's right. Yeah. So, and let's say you can see a little bit of blood vessels sticking out. We can use other things like a clip to clip on it as well. Yeah. So, diabetes and what no difference. Yeah.
Okay. I got one question from my friend.
Okay, so like indigestion, sometimes
to get like a lot of people what do you mean by incident? Sometimes they feel like it's stuck here, sometimes they feel like very bloated, that's why got more, or sometimes they feel like throwing up. So for these patients, sometimes what we have to do is make sure that the esophagus is okay. There is no ulcers inside the esophagus from the acid reflux. And we also take a look inside the stomach as well to actually see that there's no gastritis. So some of these are actually associated with this. Yeah. So we do check. I mean, if it comes with this, we actually check. Recommend a check for this, especially if it's going on for some time. Yeah. Yes.
Is the check for guys or ladies only after 50 years old, or like 30 plus you can go for check?
You can go for check. You can go for check at any age. Yeah. So this is the discussions we always want. Like let's say before 50, right? A patient comes in with bleeding. Like maybe 40 years old, they come in and we'll go straight and say, okay, let's have a look, we'll do a colonoscopy. Because when we check a patient, we only check about this much only, It's about 7 centimeters. You still have about how much? 1.4, 1.5 liters of fluid that hasn't been checked. So even if we see, right, we see something here, right, but we don't know what's above. Yeah. So we do offer a colonoscopy, yes.
Any more questions? Any questions?
Oh, yeah, I asked you all.
What is the average cost if you are doing a colonoscopy?
Average cost, okay, it all depends on where and what and all that stuff like that. A colonoscopy can go, depends on which hospital. It can go from 1,000 plus to 3,000. Yeah. So yeah, but we do know that in Singapore we got MediSave. So MediSave capable is 1,250. Yeah, so that can be covered. Yeah. Because in a colonoscopy you will have the facility fee. And then you have the doctor's fee as well. And then if there's any polyps removed, any biopsy removed and all that, then there's also a histology fee as well.
Any more questions?
I think because colonoscopy is the one where you can do something. So whereas all the others, you see something, you see shadow, or you see picture and all that, like in order to do something with all that, you check it out and all that, like you still have to go back to the colonoscopy. So, but we always give you choices. I mean, we always give people choices like, oh, I don't want that. And these are choices. We'd rather people speak for those to you. But if you between the two, the colonoscopy can actually do something. Then all that then you can remove it. You don't need another day to remove the polyp. No. Okay, sorry. When you see the doctor and the doctor just checks you, right, examine your tummy, put inside, put the finger inside the anus or put a little inside, right? They only check up to 7 centimeters. Yeah. The full examination, which is it's not an office, it's a different examination. And usually you need preparation for a colonoscopy. Remember, you got to clear all 3-4 days worth of question, like, so that's an hour for what's the scope itself, I can take half an hour or so, but because we give you something to talk you out, right? You need some time. So usually it's a half a day sort of thing. You come in, you check in, and all that, you get prepared and all. And then after the scope itself, a half an hour. Then after you will wake up and you eat. So it takes about 1 hour. Yes, it's a very basic type service.
Any more questions? Any more? Please ask. Please ask. No more? Okay, no more then let's give Dr. Alicia a round of
Okay, thank you very much. Okay, if there are any questions, okay, if she's around, you all can ask her. Okay. So now, right, okay, maybe I will say something about colon. You all know, after talking so much, you all know what colon is? Yes, okay, colon is the long thing inside our stomach there. Not stomach, the intestine part, the large intestine part. Okay, so I can see that many questions are asked because have you all colonoscopy? 有去过吗？没有去过才问很多问题。OK， 这就是对的。OK， 有没有人去过的？我呢？有没有去过 ？Yes。Have you gone before？ 你有没有去？哇，这么有一个很残忍的脸。OK，my mom went for colonoscopy before。她有去过。OK，that was about 10 to 15 years ago. So the doctor removed the polyps， 真的有 remove because 不懂是不是 cancerous。所以你们一定要去，真的吗 ？OK， 一定要去。超过40岁的，其实像我们这种年龄，我们全部都要去。OK， 所以 now OK， in order just now some questions， 你们有问一些 question 对吗 ？OK，regarding colonoscopy 啊 ，OK，there is a company, this company. Okay, wellness and medical concierge. Okay, this wellness and medical concierge, they are offering this service for colonoscopy, and you can use your MediSave, MediShield to claim. Okay, so this part I will let them talk about it. Okay, so they will mention a bit about colonoscopy and how you can use insurance to claim for this. Okay, so please pay attention. Okay, so Dato Melin will be the one introducing this thing to you. Okay, so without further ado, let's welcome Dato Melin. Okay, this part is very important. If you go for colonoscopy, okay, please listen to us carefully. Okay.
Thank you very much. Thank you for having. Good evening again. Have your dinner ready?
Yes.
Actually, Doctor never showed me video. Show me video.
I was considerate.
You did not hide your shit, right? Okay. So I want to know, how many of you understand the word concept? So what does it mean?
Yeah.
Oh yeah, okay. Okay, yeah. Okay.
I believe you show me concept is a good hotel. Every hotel has a concept, right? So, but I think that this one concept we are all under usage, even in a hotel, because you really don't know what concept. It's very, very big. And in Asia, we don't have about, like in America, in the big country, everywhere they talk about concept. But nowadays, because of this getting, we call that the bomb age. People want everything to be fast. Everything to be fast. And that's why concept came to Asia. Okay. Before I go on to talk about concept, what my company can about this word called trend. Okay. So what does that mean? Do you understand why it's trend? Meaning that if you know, okay, by doing something, you guarantee to make it. What is the trend now? Okay, let's talk about trend. Okay, what's the trend now? So trend meaning that if you know exactly what people want, overnight, right, you can't be an end, right? If you know that, you know what, McDonald's, many years ago, McDonald's went to Asia, and you're the first one to bring in the franchise. Oh my God, today, what happened? Wow, billionaire, right now. And you see now, once upon a time, McDonald's sell franchise, but now they don't take back anything. Okay? Okay. So if you understand, trend meaning find out what people want. What do people want nowadays? Honestly. Right? Different years have different things. But today people talk about what? Talk about anti-aging, right? The trend now is anti-aging, right? That's where this company, golden age, forever, means you're in 20 forever, you're in 20. So, okay, so we also talking about trend, meaning that you know that anti-aging is one of them. Right? That's why you know that many companies, many years ago when somebody opened a spa, that's where the beginning of the trend. And this spa lasts for many years, right? The first one, I think, I can't remember first one, but I do know it came in, but then this name was the right? So you see, if you don't follow, you will still go out there. So meaning you know the trend is talking about anti-aging, like what the anti-aging do. So we are in the anti-aging business too. So we know, okay, that's why I just asked you, we're in the anti-aging, and then the trend now is. So what the concept means to you, just I asked, right? Okay, so what the concept means to you, sir? No idea. Okay, no idea. Good. That's what I tell you. That's what I'm here. Okay, concept is where a place that everything in one place. You name it, they have it. In hotel, you have it, right? Let's say, for instance, you go into one. Let's say you go to Hong Kong, and then you go to travel around. You go to the concept, ask for what? Ask for a bed. Right? So it's for service provider, meaning whatever you want is at one place. But usually people don't, they just ask for bed, they ask for taxi, and they actually don't ask for a lot of things. So in another word, concept also mean for the highest one, concept always associate with high net worth, right? People think that, oh, only VIP, rich and famous, then you can have concept service. Okay? So this is also the trend. Even right now, in Orchard, you know that a lot of condo. Like, I think Twin Peaks, they even have this butler service. Can you imagine? But a condo come with butler service. And yeah, what does the butler service do? They also same thing. That means, you know what? If you have dirty clothing, they will say it for you. That means a butler maybe they can do for you everything, right? Okay. So you have to understand today the trend is having somebody in a shorter time. You know that today people are more patient, right? If you have that's why you look at their handphone now. You don't see people using Nokia, right? You also don't really see people using Nokia. Actually, it's quite sad, you know, because I remember I read something about what Nokia before he sold away the company. You know, the boss said, I do everything right. But I still fail. Because you know why? He go to his what called the trend. So you know why? I don't come in. Right? So it becomes smartphone. Everything is about smart. Everything about fast. You want your computer change. You know? After you buy this year, next year, the TV also the same thing, right? You buy a TV, in the next few months it changes. Even the washing machine too. So you see, you know how fast the changes. Okay? So why do we need concept? Why normal people need concept? Because concept usually I say already. People say concept, I'm not ready. But why you think that, you know, why concept nowadays, you know, you use it? Because as I just don't say, you know, today we want everything to be fast, be efficient, correct? So right now is concept can be concept can be happen today. Actually, it's not just medical concept in many ways. Like for instance, I saw right, you want somebody to renovate your house. There is also a concept to me, meaning you come to me, you give me a floor plan, I will get you
the cheapest, maybe the top 3, the cheapest project or contract to you. So for us, we do the same thing. Why you need a consult? Because number one, I always believe that when someone is sick, they don't have that much time, to look around. Even if you look around, you go into any of the medical center. Honestly, you look right, you can see 10 clinic. You look left, another 10 clinic, and they can be specialists. Then who are you going to look for? You really don't know. You really don't know. So that's why we want to provide this service to you, meaning we as a one-stop service. You come to us, give us a call, we will start. From there, we will service you. That means, we have to pair with the doctor. Okay, we have to pair with the doctor. We have to make appointment. And we have a daily so-called ambassador who will to you. Okay. For this part, I like to miss because I believe that all of you, I don't know. Every one of you, I believe that we all cover under medical insurance somehow, whether it's the CPF part or you buy yourself integrated plan, right? So I want to miss this one because how do you benefit as policyholder? Later on, I will explain. Okay. So I want to ask you now. I want to explain to you the difference between having a concern and don't have. So you see, when something goes wrong, okay. Like what Dr. Aiden said, suddenly having ache, or maybe the past week you passing blood, and then you say, okay, I feel unwell. So what is the reaction? When you are unwell, what do you do? What do you do? Huh?
See doctor.
See doctor, right? You look for see a family GP, right? Am I right? Okay. So you see a family GP, then the family GP is always like, that's not my forte. I can't do this. So he or she will refer you to a specialist. And then what we do beside this, we ask a friend. Right? And then after that, smart one, internet expert, they go for Google. And then they ask family who have doctor, who have experience, or they go to polyclinic. So these are the common things when people are unwell. Okay, or they go to the hospital A&E department, and you know that now the A&E department they will wait for 5 hours maybe. Okay, so the question you need to ask is, how do you know? How do you know? Even the specialist, the GP that you're a specialist, how do you know? Okay, it's the right specialist to you. So all recommendation is based on other people's experience and luck, right? Am I right? Okay, so once you get one of these and then you go to the GP. So what the GP normally will do a write letter recommend. And then if the GP is nice, the family GP is there for many years, so what they can do is they actually can make a call for you. But they make a call based on the doctor free time, right? When doctor free, right? And also, okay, so give me a contact for you to go there. And then after seeing the specialist, the specialist also say, maybe, if you see Dr. Eileen, you say, okay, maybe we have to arrange for some colonoscopy or whatsoever, right? So he will give you a letter, and then he will tell you which hospital. So that day, when you reach hospital, you're going to take a queue number. Am I right? Everywhere also need to take queue. Everywhere is a queue number. A queue number in the hospital too. So you take a queue number, you wait there. Sometimes the waiting, as I say, in the government hospital can be 5 to 6 hours, but in a private cut short, at least 1.5 hours, right? Still have to wait. And then you're going to sell administration, meaning go inside, fill in the form, and then you have to pay a deposit. And upon discharge, you will go down and then sell administration again, and then discharge yourself, and then make your final payment. Very common, right? This is what normally we do. Okay, now, when you're not well, very easy. You need to do 1, 2, 3, 4, 5 exercises. Just for us. Give us a call. Give us a call. It start. Process the condition.
they start the process and contact us. Alright. And we will help you. We will talk to you, of course, we will fact find, what's your need, and then we help you to we will arrange appointment. We arrange appointment according to your time. Okay, just now is the doctor time. Now is your time. Let's say you say so we will find out the condition and the we will find out get on your time on the free time. Okay, so we will then tell you all the details. We will tell you the doctor profile. So you will be confident to know who are you seeing, what's the expertise. Okay, we send to you. And our contact ambassador will actually contact you, right, and tell you, introduce herself, and then set appointment for you. And she will meet you there at the clinic and do the registration for you. Okay. Same thing upon you required or admission, meaning you still need to go to the hospital. The ambassador will lie with all the nurses and admission requirement. Arrange a limousine to pick you from home. Our service will pick you from home. Okay. And our ambassador will meet you at the point in the hospital, greet you, and go through all the hassle of all this. Have you to arrange, okay, this part I missed, okay, and escort you all the way to the ward and inform the specialist that you're already ready, you're there, and keep your loved one informed. Okay, upon discharge, okay, we will help you to check your bill, whether it's the billing is correct. And we will, if we can, if your insurance is permit, alright, we will arrange a cancer checkup for you. And we will make sure, we send you home safely. And that is not the end yet. And what we do is we will follow up for your next follow-up appointment of the date and time. Okay, so in a nutshell, meaning that if your loved one or you or your friend who's unwell, or you can call our hotline, our ambassador will arrange the appointment. Okay, we will log the client to the system. And then we will remind, okay, that your ambassador will create a relationship with you, okay, arrange the person meeting and send you home. And okay, we can only because we work with specialists, so we only send you to a private, we can't send you to a government hospital. Okay, so we ensure that you have peace of mind, rest, and waiting for the test. And we keep your family, your loved one of your status, it's a SOS service. And we ensure that the client will show safety and then until the next appointment. And if you got the insurance, we will help you to assist you with the insurance claim. Meaning that we will help you to collect the form, give it to your insurance agent, so your insurance agent can process the form or get a doctor to do a doctor report for you. That's what we do. Okay. Last but not least, I'd like to share this story about Dr. Michael Leong is a medical doctor himself. He is not like he can become a doctor. Okay. So, Dr. Michael Leong, okay, the reason why he wrote this, he passed away this year. Okay. So, he wrote this is because he tried to advise people that even he as a doctor, this colon cancer caught him as a doctor, right? Because every year he go for all the blood check, the blood, full blood count, he will go for cancer marker and everything, and ECG, everything, and the bill is always clean, meaning she's always in the pink of health, right? But after age 50 something, the wife keep pressing him to do colposcopy. So finally, he agreed at age 53, he went for colposcopy. The bad news is they found a polyp and already developed into a cancer stage 3. Okay. So you can read from here, he said that he eat very carefully. He eats more green, more veggie than red meat. Right? And he also exercise and he do all he can, but still, right? So it means to say that after age 40 or 50, like what Dr. Aileen said, we all take masks, to go for a screening. A lot of people tell me, even must we go for a screening? I don't have, there's nothing wrong with me. Precisely, it's because nothing wrong with you, that's why you need to go for a screening. Because if something wrong with you, then you go for a screening, this will happen. So after 2 years, after 2.5 years, although promising is like he's going to live, but he didn't make it. He still passed away this year. So this is to tell us that for a doctor like him, colon cancer also can happen because you know why? It's number one killer. Like what Dr. Aileen said, even you don't have a family history, but 5%, meaning out of 20, one of you. And the reason is because why today nothing we eat is natural. Nothing we eat is actually grown from the ground. Correct? So this is very, very important. So I really urge you, that if you have aging parent, or above 40 over, everybody should actually go for colonoscopy. And then, let us help you. Let us help you, to that. But of course, if you have an insurance, it will be easier because your insurance will pay for it, right? And a lot of people may think that, wow, that may be very expensive to get a concept to do for you. But I will tell you, based on our Ministry of Health, the doctor really have to be the same. They cannot say, because of concept come, then you charge you higher. No, it got to be the same. But the only difference is you have somebody who can walk through with you and help you all the thing that you don't know. Because, until today, I'm still learning. Still learning means medical thing. Okay? But learn from this doctor experience, and then save yourself. Okay? Oh, as Dr. Aileen already showed you, right? How actually talk about polyp. But let me tell you something. Scary enough. Most of our clients who went in, I will tell you, 98% of our polyp. I don't know why, and sometimes as young as 30. Okay. So only 2%. I also don't know why this one you also ask Dr. got this. I think maybe he can do eat, right? Okay. So this is also doctor also show you. So if today whatever the doctor tell you or I tell you can't remember, but I hope that you can remember the telephone number. Because this one it may help you in case of emergency in the middle of the night suddenly. Because we actually, our concept is around the clock and 24 hours, alright? So take down this, yeah. So that's about all I share. Thank you. And if you have any questions, please. Okay, thank you.
我去你的电脑。
Okay, so have you taken down the number? Taken down the number? You all have name cards, right? Okay, so 如果你们刚才没有抓紧那个机会写下那个号码的话，他们后面有那个名片。Okay, they have the name card. Please take it out. Okay, so you all know what? Okay, that means you can use insurance to go and claim for colonoscopy. So for colonoscopy, very important. And you all need to have insurance, medical insurance. But then, okay, 第一排的不可以问，不可以问第一排的。Joanne， 我可以问你。我懂，你刚才你是在看那边对吗？你不敢看我对吗 ？Joanne， 你没有买保险？什么种保险？你那个买对 Esther，你买保险吗？Esther，你买保险吗？不讲真，他这个买 Medishield 啊，有没有买 Enhanced Medishield？ 有吗？好像有，好像不懂有没有？对，等一下，你们有买保险吗？不懂，不懂，那有买保险吗？没有，真的没有，真的没有。帮你买保险吗？有哎，鼓励小宝贝啊，有买保险吗 ？Yes 啊 ，OK。Okay, can I have a show of hands? Okay, who are insurance agent over here? Please raise your hand. Insurance agent, Krista, and Sally. Okay, or you are also insurance agent. Okay, you know insurance agent 啊，保险经纪人啊。Every time MRT there, right? MRT 啊 ，okay, got insurance agent. Okay, 我们会在那边 Okay, but all of you must go and get insurance. Okay, I got my own insurance. Okay, basic Medishield is not enough. You must get what? Enhanced. And what? Rider cover everything. Okay, private is the best. Cover everything. So that if you go to the hospital, okay, go to the hospital. If your bill is $5,000, you can claim all. If your bill is $10,000, you can claim all. Understand? Must get very important. Okay, life insurance also must get. Okay, hospitalization must get enhanced Medishield. If you don't buy, so 你们两个一定要去买的。年轻的时候不要以为我单机车来我会做这些东西，我单机不可以。啊 ，Pokemon 啊，哎 ，Pokemon 谁玩 Pokemon 啊？一定要去买 insurance 啊。Okay, my insurance is very important because 我身边的人有进过医院，没有买 insurance 啊，结果那个 bill 来多少钱？有吗？几万块的。几万块的 ，OK， 过后你发生意外的时候，你进医院 ，OK， 你花了几万块不要紧，过后你讲 ，OK， 我要买 insurance， 哇，假的，买不到，所以你们全部都要去买。这边有几个啊？谁 ？Krista， Sally， 所以这边的人你们找他，后面的人你们找他 ，OK， 所以有什么问题吗？哎，没有什么问题的话，我就会简单介绍我们公司的产品。好吗？好。OK， 谁要知道的举手。哇，全部都想知道。OK， 来，给我15分钟哇，很快的。然后你们全部要留下来，因为我们有一个什么 shot， 我们有一个什么？中吧，我们有一个中吧，一定要跳舞，一定要跳舞。OK， 来，就简单介绍啦。OK， 我们公司叫冻龄 Frozen Age。哎 ，sorry 啊，校长，可以帮我把那个。这个 speaker 的，在 Mac 后面，iMac 后面，跑到那个，后面跑到
有动吗
？OK， 我们的公司名叫什么？
冻龄。
为什么叫冻龄？冻结年龄。OK， 所以你们年龄全部被冻结了。好。OK， 所以 today I'm going to introduce to you health products 保健产品。OK， 保健产品。疾病 ，OK， 有人还有 PhD， 可以帮你的 explain， 帮我解释一下 ，OK。所以疾病是什么 ？illness，OK，familiar illness，familiar 癌症、心脏病这些 ，OK， 帮你们年轻人 ，OK， 我们年轻人是可能还不需要知道这些，不过这些10、20年后就可能会发生在我们的身上，可能 ，OK， 这些你们注意一下，诶，癌症。我们的人的细胞里面有多少 ？100 million 细胞 ，OK？ 如果细胞有变化的话，就会变成什么？就会变成什么？癌细胞啊！癌细胞会不会危险？危险 ，OK？ 有多危险？等一下我们看啊。癌症有几种？有几种 ？OK？ 刚才Dr.艾丽莎提到几种？一种 ，OK？Colon 还有哪个啊 ？OK？Colon 和哪个啊？所以癌症有几种？超过100种。诶，男的什么肺癌、肠癌，就是 colon 呢？还有前列腺，你们懂什么吗？那你懂前列腺是什么吗？在哪里？不可以指出来啊！前列腺就是 prostate， 你的呢 你的要猜一下吗？你的通常有什么？乳癌 ，OK， 第一个是乳癌 ，yes。子宫也是，不过子宫好像不是很高。然后第三个要不要猜一下 ？lung cancer， 来看一下啊，一样 ，lung cancer，OK， 口腔 cancer 还有 breast cancer， 你们要注意 ，OK。来看这个是什么 ？Cancer Research UK， 这个从那个 website 哪来的啊 ？OK， 来看一下，你们看 ，1 in 2 born after 1960 in UK diagnosed with some form of cancer， 这个是什么意思？ OK， 就是简单的来说啊，每2位有1位会得癌症。这里我们有几位？大概30位。你们懂什么意思吗？100。
错一点。
OK。这些是 statistic 来的，这些 statistic 来的。OK。Every 2 minutes, someone in UK is diagnosed with cancer. 2012。 新癌症的这个 case 有几个？14个 million，OK， 死亡有多少 ？8.2 million， 所以死亡率多少？死亡率多少 ？Mr. 死亡率 58%， 每2个就会有1个中 cancer， 每2个中 cancer 就会有1个死亡，你们了解吗 ？OK，Every 4 minutes someone in UK will die。 预防，刚才我讲什么？保险 ，OK， 谁这里没有买保险的举手？啊，那刚刚举手，举手 ，OK， 谁这里有买保险的举手？有买？有买保险 ？OK，thank you，thank you。谁这里有买保险？不懂买什么保险的举手？哦，对，不懂，你们要去了解一下啊，买保险很重要。保险是什么？有事发生的时候。 才用到保险的，对吗？没有事会不会用到保险？没有事会不会用到保险？不会。所以我们要预防，可以买保险，而且我们要吃保健。预防疾病，还有预防用到不可能得到的保险。 我们有事时候才用到保险，懂吗？所以如果你有健康的问题，还是没有健康的问题，2个都要 ，OK， 了解吗？然后，我就介绍我们公司的产品，这个就是坐在后面那位要跑去哪里啦 ？OK， 他有去那个纽西兰 ，OK， 找2个产品来，这位是 Eric 刚才也在后面。 对，所以团队他们真的去那个新西兰找到什么东西？这个是什么？这个什么？鹿胎盘。所以这里有吃鹿胎盘的举手，举手有吃的举手。OK， 对，所以有吃鹿茸的举手，有吃。OK， 谢谢。所以长得像鹿的举手。OK， 没有人，谢谢。OK， 所以我们的配套是什么？这2个。既然我们的配套是这2个 ，OK。 所以这个鹿胎盘，你们都懂，很有效的。OK， 我不需要讲太多，很有效。这个鹿茸也是非常有效。OK， 等一下我们看见证就好了。这个鹿茸可以治疗超过50种病。OK， 然后来看一下这个是谁？美人蛋，有看过美人蛋吗？所以你觉得他像几岁？ 哇，60岁，他是几岁？80岁 ，OK， 抗衰老。这位是谁？Jeremy， 你的脸在这里 ，OK， 所以 Jeremy 他也是有吃鹿胎盘 ，OK， 他以前发生一场大病，不能吃药，吃药会进医院，所以他吃的腰酸背痛变好，他可以吃我们鹿胎盘，他不吃药，所以有东西你们可以去问他 ，OK， 你跟他拍照。这个是谁？本人。 不可以问，不随便的。啊，各位，这个是谁？有看过吗？有看过啊 ？OK， 连注也是以前很多问题了，现在都 OK 了。OK， 他今天不在，现在的话你们可以问。 这个是我的顾客关节炎，这里有谁还身边的人有关节炎的举手？关节炎，你们身边的人有没有关节炎？谁？阿曼，痛吗？痛吗？关节炎，我顾客3个月后完全康复 ，OK？ 还有这个Mr. N， 走路那时候走路啊不可以走，车祸需要用拐杖，拐杖吃了我们这个配套过后，1个月就不需要拐杖了 ，OK？ 所以这就是我们的产品的效应 ，OK？ 所以这些都是其他的见证，所以你们都没看。这位是 Barbara 是 BC 的姐姐 ，OK？ 还有这些人 ，OK 都吃了我们的产品。然后我们也是有保险证书 ，we have insurance, so it's very safe. It's safe to eat. Okay, don't worry. Okay, it's safe to eat 啊。Okay, so this package 这个 package 啊，这是什么？细胞活化细胞，细胞活化配套叫什么？细胞活化配套。OK， 这个活化配套是什么东西？大家注意啊，每一天早上吃1粒，早上吃几粒？1粒不是1罐 ，OK， 1粒啊，有1个复活的 ，OK， 早上1粒，鹿茸怎么样用？早上喷几次？5下 ，OK， 下午喷几下？5下 ，OK， 然后呢，含几秒？20秒，你们懂为什么要含20秒吗？是，你懂为什么要含20秒吗？舌头下，不要喷的。OK， 不是我的漱口，不要喷哦，可以啊。OK， 喷了啊，含20秒才吞。记得这个加这个每天900新元，多少？900新元。OK， 3罐，再加3罐，3加3。OK， 3个月900块，一天多少？10块钱。你们每天有没有花到10块钱？有花到10块钱？没有，谁？等一下，谁讲没有？你在新加坡做工吗？我在美西做工啊？你一天花多少？5块马币。你花5块马币。你是什么？你是那个钱。OK， 所以一天只需要花多少？10块钱。多吗？多吗？你不多吗？不多，很少。为了健康 ，OK， 3罐再加3罐，买多少？900元。第二次买多少？你们懂吗？第二次买多少？700。第二次买700，你们懂为什么吗？你们懂啊？谁懂的举手？那为什么你不懂？你懂啊 ？OK， 谁懂的举手？谁懂的举手？为什么是700元？谁懂的举手？啊，没有人懂啊？9人懂吗？懂吗 ？50懂吗？为什么700？懂啊 ？OK， 然后会越买越便宜，永远900啊。有健康问题的就调好健康 ，OK， 没有健康问题的就保健体验产品。然后继续保健康，它的健康很重要的 ，OK， 所以从开始到现在，什么东西没有健康可以不可以赚钱？不可以 ，OK， 所以 OK， 不妨问一下，谁这里有健康问题的？不妨问一下，还是后面有一位，还有谁？身边的人有健康问题的，可以举手一下。身边的人，所以你们身边的人是谁？家人。我爸爸的糖尿病20年，所以健康很重要。健康重要吗？重要啊！重要，谁要怎么样？保健，健康要 ，OK， 健康很重要吗？所以要什么？保健，还有买保险。这2个你们都要，了解吗？所以今天给我们就讲到这里，OK。所以如果你们有兴趣买那个配套的话，还是对那个刚才那个加工要想了解多一点的话，你们可以去问 ，OK。 所以大家请注意，下个礼拜四，下个什么？下个什么？礼拜四啊，礼拜四我们有什么东西 ？OK， 下个礼拜四每个人带一把刀，还有一个叉。OK， 来这里，我们要做什么东西？吃东西。OK， 记得带东西来给大家吃，不是来这里吃东西，好吗？带东西给大家吃啊。OK， 不过还是要吃啊。OK， 7点半在这里，然后给我们后面那位老板，我们的老板 ，OK， 他就会给你们一个 general update。OK， 大家吃饱饱就去听。OK， 所以下个班是7点半，OK， 带10个人的吃了 ，OK， 不要带白饭来嘛 ，OK， 就带一点真的好吃的料来了 ，OK， 听懂吗？听懂吗 ？OK， 下个班是记得要出席啊 ，OK， 所以没有什么问题的话，说我们现在准备什么东西 ？OK， 所以现在我们有一个小小的一个东西啊 ，OK， 所以来准备下个拜四啊。下个拜四我们要做什么？好了，其实是很重要，不过更重要的是什么 ？General update。因为我们的 CEO， 我们的总裁 Desmond 许正荣先生，他会给一个 General update， 所以你们一定要来，这个很重要的，真的很重要，你们一定要来 ，OK？ 老板难得要给一个 update， 老板东西有话说了。
既然我已经在这里 ，OK， 没有啦下星期四最重要的是，因为其实我们有很多的这个制度嘛，就是我们的回馈的那个制度、奖金制度有一点点的改变，然后很多的其实会员也都还不知道，所以如果可以的话，就再把他们邀请回来，让他们知道，其实现在因为公司开始扩张了嘛，原因是我们在雅加达也开始会有新的办公室，然后在中国深圳那边也有办公室。Okay, we have office over at Jakarta, we have office over at China. And a lot more opening up. That's why, cost-effective wise, we have a lot of updates for everybody. 所以可以的话，就是把朋友，就是可能之前都有来过也认识的朋友，今天我一直在讲话，就让他们可以快一点手脚，你知道吗？不然他们西北慢。OK， 好 ，Anyway， 你看他，对 ，Anyway， 重要的就是让大家有机会啦，就是也知道一下我们这里的一些的改革，然后呢，也让他们知道下来可以怎么样大家一起合作。然后基本上就是这样的一个运作。好，你的蛋糕出来了没有 ？OK， OK， 大家知道我几月几号生日吗？他们竟然以为是今天，我这样一讲，他们突然间感觉没有，这个不是我的蛋糕。谁是在1月份生日的？1月份，1月份，他们2月份。哦，跟我一样，2月几号？2月3号啊。我是22号。3月，哇，3月还挺多人的。4月、5月、6月、7月、9月。9月啊。快要生日了，这样。10月、11月、12月，哇，基本上不错的都有。那8月的呢？8月，谁8月生日？8月现场只有一个啊，今天。哇，对呀，还有，Eric 跑掉了啊，是 Eric 跑掉了。你们不要认啊 ，OK， 认到了，等下你们就夹了，我跟你讲。8月不用了哈，8月，Eric 8月啊。随便了，今天8月了，我要叫你去了。
我们只有一位8月吗？来，就你一个啦，所以整个蛋糕都是你的啦。OK， 他有用冻龄产品，所以你们要猜他几岁吗？猜他几岁 ？OK， 所以21生，20几岁？16啊！哇，越来越夸张了。这个20，这个30啊，这个20、16，那你就是12了，15了，18了。OK。
我17岁的秘密。
OK， 你要不要跟他们讲？不要跟他们讲，就告诉他。
今年
哦，哎，你怎么知道的？你刚才有录过发音吗？没有，哇，真的很厉害。OK， 所以他今年30，几岁啊？几岁啊？就
客气一点，客气一点。有没有用动物的？
你们都
没有，
没有 ，OK， 没有就比他大，就比他大就对了。OK， 哎，大家到前面来，到前面来。啊，后面的那排哦，那一条线那边啊，你们过来，就过来了，过来。起来，我们唱6点独唱。OK， 来，我们唱啊，唱华文啦。OK 啊，来，1、2、3。祝你生日快乐，祝你生日快乐，祝你生日快乐，祝你生日快乐。OK 啊 ，1、2、3。Happy birthday to you, Happy birthday to you, Happy birthday to you, and Happy birthday to you。对，所以你要许的愿，对，自己许的。OK， 所以愿望不可以讲的啦。不过我知道你愿望是什么，我就跟大家讲一下。OK， 其实他的愿望就是大家可以在冻龄，对吧 ？OK， 还有赚大钱。OK， 所以现在你就要去。拍照，别拍照，有拍照吗？有吧？OK， group photo 啊 ，OK， 我们大家拍一张照 ，OK， 我们有那个 selfie stick 吗？谁有？有张 selfie stick，boss 你 selfie stick 吗？对，没有的话就不要拍了，不要多拍 ，boss 先拍吧，这样。OK，anyway，我们的 boss 在新加坡5.6 million 的这个人口是 selfie king 最厉害的。有多少人他都可以拍。哎，你们自己找那个，你在里面的话我不懂啊。哎，抢镜头啊！抢镜头啊！抢镜头啊！从那边是从那边啊，不是。所以大家学一下，所以在这种场面一定要拿把椅子过来。
我后面的人看不到了。啊，在我后面看不到了。1、2、3，再来1、2、3。
OK， 现在大家留下来上课啊，吃可以走，没有吃不可以走。OK， 我们有一个，我们阿宝拿这个盘来，我们应该，阿宝有盘上。